I came to Dr. Madsen probably 4 or 5 years ago, initially for rotator cuff surgery. I was very pleased with what he did with my shoulder, and so I came back to have my knee replacement.
Although there's an expanded group of patients that we can now include and successfully operate on and give a total knee, but it's always the last resort. So there's a multitude of things that we do before the total knee replacement. They start with activity modification, weight loss. Sometimes we can do bracing. We can do simple medications like Tylenol or over-the-counter anti-inflammatories. There's cortisone injections that we can utilize to give them more time, and it's as long as we can control their pain and keep them active. There's a number of things that we can do right now to keep people going for as long as possible. The total knee is really the last resort.
And it finally got to the point where he said, well, about all that's left is we're going to have to replace your knee. And I'd ask him, I said, well, when will that need to be done? And he said, well, you will know.
Anybody who has unremitting pain that can't be controlled by conservative methods really is a candidate for a total knee.
Both knees were replaced, and Dr. Madsen did an excellent job on both.
And I enjoy watching them get better. We have a good relationship. We talk before surgery, we answer all the questions, we go over the expectations, what they expect and what I expect of them, and what they can expect in the future. And it's really satisfying to see them doing well.
Like I say, it's somebody that I trusted, that I felt very comfortable with. I think he's a very straight shooter. He tells you kind of like the way that it is, and here's what you've got. I felt real comfortable with Dr. Madsen, and if I didn't, I wouldn't refer him to other people, especially friends of mine.
I had told Dr. Madsen that if I had more knees, I'd make sure he would be the one to replace them when they were needed. He did a wonderful job.
Most of our patients do well. We take them from a point where they're either unable to do something or in pain when they attempt to do things, and we're able to change that. One of the reasons I went into orthopedics is most of the patients do well. It's a hands-on activity, and you can develop a relationship with your patient and watch them go from being unable to do the simplest thing to going back to what they like to do. When you give them back their life and their lifestyle, they're very grateful and very happy.